January 26th, 2021. Believe it or not, we made it through 2020, which we are all incredibly excited about. I am looking out my window, and I'm on the East Coast. I practice and live just Bucks County, Pennsylvania, outside of Philadelphia, and we have some freezing rain, maybe some snow later. So I want to know where you are. If you can type into that public chat in your YouTube page as we go live right now to the world, the veterinary world. Where are you from? Where are you? What is your weather like? What do you love doing? Just let us know. We love interacting with everyone. I'm going to introduce, as we hear from you, our other people on the feed. My bottom right corner, we have Justine Lee. Justine, why don't you say hi and let everyone know where you are and what you're doing?
Hi, everyone. Thank you guys so much for joining. You guys are in for a 25-30-minute packed lunchtime talk, or whatever time zone you're in. So I am also, like Zach, in the frozen tundra of Minnesota. It's probably 20 degrees. We have a couple inches of snow. It's cold, and excited for you guys to all tune in. And make sure to share this with your colleagues too. So increase the awareness on monitoring diabetes. So everyone, welcome.
And then I also want to introduce, on my top right of my screen, we have our esteemed speaker with us today, Dr. Nyssa Reine-Salz. So Dr. Reine, where are you? Where are you right now?
I am in the frozen tundra of New Jersey, where it is, I don't know what the temperature is because I haven't been outside because it's too cold, but we have about 1/4 of an inch of snow.
Wow.
Yeah,
and had my children gone to school today, they might not have gone to school today. But
yeah, the East Coast is getting some bad weather right now. So hopefully everyone on the upper East Coast is staying safe. This is nothing for Justine. She's like, 1/4 of an inch. We don't even wake up if there's 1/4 of an inch. We wait for there to be more so we can play in it out in Minnesota. But again, we want to welcome everyone. We're excited. We're honored that you've taken the time to be with us here, at least this afternoon where I am. It's 1 o'clock Eastern time now, just a couple of minutes afterwards, but excited you were all here. So as people are logging in and we're getting all of our members to join us on your lunch break, well, I should rephrase. We know we don't get lunch breaks. So you're shoving a granola bar in your face as you're trying to frantically write records. Maybe try to manage your diabetic patient. That's what we're here for today. So while we're doing that and you're getting situated between appointments, let's go ahead and get started. I'm going to do a little bit of housekeeping, and I'll keep everyone on the screen right now, and then we'll filter everyone out. But we're going to be talking about monitoring diabetes today, old school to new school. And I wanted to thank Merck Animal Health. As many of you know, when we have the generous support of an educational partner like Merck Animal Health, we try to provide free, race-approved continuing education to the veterinary community and the veterinary world. So we want to big shout out, give a huge shout out, and thanks Merck Animal Health for allowing us to provide this awesome content and having Dr. Reine-Salz here with us today. So thank you to Merck Animal Health. For those of you that are joining, maybe this is your first VETgirl event, what you're going to quickly learn is that we are the tech-savvy way to get your race-approved CE. So we have YouTube live events like this, traditional webinars, podcasts, blogs, really a multimedia approach to education. And really, when we talk about education, not just small animal, clearly we're talking about small animal today, but we have small animal, large animal, technician focus, leadership, practice management, nutrition, and the list goes on. So if you're not aware, definitely take a look at our website, check that out. Any questions, let us know. We're happy to chat. We also love our VETgirl forum. It's a great way to interact with colleagues from across the country and across the world. If you have a case question, want to talk about your tough day, a job post board, we have it all there. So definitely make sure you check out our VETgirl forum, and make sure, like we're on YouTube today, make sure you interact with us on social media. It's a great way to learn what upcoming content we have. We post cool x-rays, funny pictures. We like to have a lighthearted good time on social media. So whether you tweet with us, like us on Facebook, you gram with us on Instagram, just make sure you interact with us. We love seeing you there. Now, as we are on YouTube today, YouTube live event, if your screen is that smaller box screen, you should know, if you don't know, you can make this screen your entire full screen of your computer. In the bottom right corner of that video feed that you're watching now, looks like it's almost a square box, the one all the way to the right. If you click on that, it should make that screen full screen for you. If you want to get out of full screen, usually you can tap it again or click the escape button on your keyboard and it'll come back down to normal size. But as we get into the presentation with great pictures, text, video, you may want to make that full screen. Now this is very, very important. So this is RACE approved. Here's how you are going to get your RACE CE credit. So I have a big, nice QR code on this screen here. I'm going to go forward one slide for one quick second. This is a picture from my phone. All you do is open up your camera on your phone and point your camera to that QR code as Justine is showing you right now. Any new-ish phone in the last couple of years, as you see in the top corner of my picture right over here, here's my mouse. You guys see that coming through? Your phone should recognize that QR code is trying to tell you to go to a website. Click on that. It'll open up a form where you enter your information, and that's how we will know who is here with us live for the event. Throughout the entire presentation, or up to 30 minutes after the event, we're going to keep that form open. At around 2 p.m. Eastern time, that form will be closed, and only those that filled out that form will get CE credit. If you don't have a smartphone, I have a URL, tinyurl.com/1-26-21/VG diabetes. If you type that into any browser, it'll open up the same form. But again, any phone that was built in the past couple of years, just point your camera to it. It'll take you to a website when you click on it, and there you go. And I'll have this QR code found throughout the presentation. So if you forget, it'll be there for you. Or again, that tiny URL will be there for you as well. With that said, I know you're not here to listen to myself or Justine. Again, I wanted to introduce and thank Dr. Nyssa Reine-Salz for being here with us today. I'm going to mute myself, mute Justine. We're going to drop out. We'll be behind the scenes helping to answer questions. We will talk about questions after the presentation as well. So if you have them, type them in. We'll get to as many as we can. But Dr. Reine, thank you again so much for being here. If you can let our audience know, I know you said from New Jersey, but you know, what do you do? What's your passion in veterinary medicine? Anything you'd like to share with us? And then please take it away. The floor is going to be yours.
Great. Thank you so much for inviting me and having me today. I am a native New Yorker, so I will never say that I am from New Jersey, but I currently do live in New Jersey. In my veterinary practice, I practiced as a veterinary endocrinologist at the Animal Medical Center in New York City. And then once I left practice, I was briefly a consultant on VIN. And I am currently the internal medicine consultant at Merck Animal Health, dealing mostly with managing diabetes in dogs and cats. My knowledge of diabetes extends to the human realm as well, because in 2011, I diagnosed my son in a rocking chair with type 1 diabetes. So I have a vast experience with diabetes. I often joke that I live diabetes 360. So as to what we are going to talk about today, I thought my plan today is to briefly as possible, review diabetes itself, and then sort of take a deep dive into the monitoring options that we have for our patients now, taking into consideration the new challenges we have that have required us to utilize remote monitoring as much as possible, and see how we can apply these different modalities to our new kind of practice. And I honestly believe that opening up to options of monitoring diabetes remotely will actually help us once, God willing, this COVID business is behind us. So we'll also discuss how to use these different modalities specifically in the challenges remotely. So let's start our deep dive. So diabetes, by definition, is defined as an absolute or relative deficiency of insulin. And it is diagnosed typically by confirming the persistent hyperglycemia or glucosuria in the face of a patient who has the appropriate clinical signs, which are most commonly polyuria, polydipsia, and polyphagia. With regard to the different species, diabetes in dogs most closely resembles type 1 diabetes in people, in that it results from an inability to produce insulin, most commonly associated with immune-mediated destruction of the pancreas. Because of this immune-mediated destruction of the pancreas, these patients will require lifelong insulin therapy. And to answer those owners who present to us saying, "Doc, can't I just give them a pill?" In fact, the fact that they cannot make any insulin makes the use of most oral hypoglycemic drugs contraindicated in dogs with diabetes. Cats, on the other hand, their diabetes most closely resembles type 2 diabetes in people, but being cats, they cannot do things as any other species would do, and they have their own version of it, in that they make insulin, but there are factors in their body that make it not work well. Dietary management is essential in cats with diabetes, as it is with people with type 2 diabetes. And you could consider using oral hypoglycemics, although our experience with them historically has not been great. So invariably, most cats with diabetes will require insulin therapy. On the plus side, it is possible with aggressive monitoring and dietary therapy to induce remission in cats, but oftentimes this remission can be temporary, and cats can actually go in and out of remission several times throughout their life. And being cats, they have to make things more complicated. So often stress hyperglycemia can complicate the diagnosis in cats. Next slide, please. I've listed here the most common modalities that we use in our patients. And we'll now take a second. We'll now go ahead and review each of these modalities individually. So, owner observation. It's clearly the lowest tech option on the list, yet at the same time, it is incredibly valuable. Clearly, owners, they know what the signs of diabetes are as they experience them at the time of diagnosis. And they can equally tell when those signs improve or at some point recur. So the advantage of owner observation is anyone can do it, and it's free. And the owners actually have the best perspective on how the pet is doing. The disadvantages of owner observation are that it does not provide any objective assessment of glucose, and it does not allow us, because of the overlap of clinical signs, it leaves us not able to determine if our insulin dose is too high or too low. And lastly, not all owners are the greatest of observers. So we are relying on people who may not be the best at noticing things to notice things. So now let's look at some ways that we can help our owners record these observations. On the left, you'll see we sort of have an old school method of keeping track of our pets, and then on the right, a new school way. There's lots of different resources out there. This example on the left is one from vetslin.com, and having any sort of preformed sheets or an app provides a bit of a reminder of the parameters the owners need to monitor, as well as a way for them to record it. Things like appetite, water consumption, attitude, urinations, things like that. And though the apps are more directed toward people who are doing glucose monitoring at home, they do generally have observation areas that can be very useful. In addition, the app has the advantage that many will, if the owner enters a parameter that would suggest that there could be something wrong with the pet, there'll be like a little pop-up that says, you should call your veterinarian. And it can be handy as well. And it's imperative that we take the time to review these materials, as they can help us better understand the entire clinical picture. If an owner provides you with a log, excuse me, that indicates the dog's water consumption is totally normal now, he's acting better than ever, but your glucose curve is a mess, you would lean towards the clinical signs indicating control is good, and it would definitely help you determine whether or not you should make any treatment changes. Now let's move on to urine sugar monitoring. Back in the day, when I first graduated, I won't say when that was, urine sugar monitoring was a mainstay. As glucometers were not as readily available as they are now, they weren't validated for use in pets, and they often required significantly larger blood samples. The use of urine dips is based on the fact that glucose will spill into your urine when your blood sugar exceeds your renal threshold. The owners will use a test strip to get their pet's urine sample. And the advantages of this are that the owners don't have to get involved with any scary needle sticks or blood, which for many people is quite intimidating. It is a form of objective assessment. And one of the great things about using urine sugars for monitoring is that if you use keto diastics or urine sticks that have both glucose and ketones on them, it will test for the presence of ketones in the urine. And you can train your owner that anytime they find ketones in their pet's urine, they need to contact you as soon as possible. And if the pet is ill at that time and they're not able to get in touch with you, you can train them that they need to seek veterinary care elsewhere. Another great use for urine dipsticks is to predict remission in cats, in that if a cat is in remission, their urine sugar will consistently test negative. But to be honest with you, most times when you're trying to use urine sugar to predict remission and the cat is actually in remission, the owner will say something along the lines of, I can never get my cat's urine, because I can never get my cat when it's urinating, because they're urinating such small volumes and secretly like a normal cat. Some of the disadvantages of using urine dips is sometimes it can be challenging to collect a sample, particularly from cats, although there's lots of information about how to alter the litter box situation so that they can get some urine samples. And like I kind of intimated earlier, it's a little easier when they're poorly regulated than when they're well regulated. And for dogs, the owner has to kind of catch the sample, maybe in a cup or a container, and then carry it home to do the testing. And then it's a very time sensitive test, in that if you put a urine dipstick in a urine sample of a pet whose urine sugar is very low, if you leave it sit long enough, it's eventually going to turn all the way brown, like it would in the picture there, and your answer will be inaccurate. And also, the urine sugar doesn't correlate exactly with the blood sugar, because the urine is stored from the time they last urinated till the next urination. So the blood sugar could be much higher at any point than it is when at the current time. And if you just go by urine sugars, because of this inaccuracy, you may adjust the dose when not necessary. So it's really important that you interpret this urine sugar based on the patient that's in front of you, and because the sugar will only spill into the urine when you exceed renal threshold, and that renal threshold may be higher than normal. It's difficult to determine whether your pet, if their sugar is negative in the urine, whether they are well controlled or over controlled. So that can be tricky, but you should just train clients that if their pet's urine sugar is negative for more than one day, they should contact you to discuss potential dosage adjustment or other forms of monitoring. On the next slide, I have an example of some recommendations from AHA on how to interpret urine sugars. If it's negative, your dose may be low, too high. They recommend targeting the lowest number that's positive. And honestly, that was kind of our goal back in the day when we used to use urine sugar monitoring all the time. But again, it's important to remember that these are just guidelines. And like I said before, if the pet's glucose is high and low within one urination period, you'll get a high urine sugar reading, even though the animal's blood sugar might have been low during that time. So you might make the wrong treatment decision. So again, you want to interpret it based on the pet that's in front of you. The next slide, I have another protocol that's on the VETgirl website of using 3 different urine sugars throughout the day, morning, midday, and night, which is another way that you could potentially use urine sugar more specifically to try to get some handle on, some information, better information about your insulin dose. But this again could be challenging if the owner has difficulty collecting the urine sample from their pet. All right, so let's move on now to spot glucose monitoring. Spot glucose monitoring is really just when you either choose one time at the same time every day, or you obtain a few you choose one time to measure the blood sugar throughout the day, or you do a couple times a day. But it's basically measuring blood sugar at a frequency that would be less than a curve. And it has an advantage of that. It is objective measurement of the pet's blood glucose, but it is well documented that even in well-regulated dogs, there's incredible day-to-day variability in blood glucose curves, which can include the nadir, meaning the nadir can be at a different time each day. So even if you pick the same time every day, if you rely only on the blood glucose that you measure, then you may make the wrong treatment decision. As with urine monitoring, it is imperative that you interpret your blood glucose measurements based on the patient that's in front of you. If your blood glucose is out of target range, but the owner is happy with the pet's clinical condition and the body weight is maintained, it may be that we're just catching the pet on one of those bad days, and it's advisable to hold off on dosage manipulations at that time. Moving on to serum fructosamine monitoring. So, and I don't have up here, but certainly A1C, there is now a kit available to measure A1C in our patients. And both fructosamine and A1C are markers for mean glucose measurements over a certain amount of weeks. And they're basically formed when excess glucose sticks to whatever protein it is that's being measured. It has the advantage that it is a single blood sample, which for a lot of people like it for those very stressed out cats, because it should not be, since it is an average glucose measurement, it should not be affected by day-to-day stress. From disadvantages is that it does not give us any information about the insulin onset of action or duration, or the glucose range and nadir, which we'll touch on when we discuss glucose curves. And it will not give you the ability to discern between a pet who's experiencing overswing, meaning periods of time during the day where their blood sugar is low, followed by high blood sugars, or if their insulin is not working, or they have insulin resistance, meaning their glucose is high all day because of inadequate insulin dosing. Because in that situation, you could have an elevated serum fructosamine either way. And it does not always correlate with regulation status, and I have some examples coming up. It can be high in a well-regulated pet. And like the previous forms of regulation, it should always be interpreted based when considering the clinical condition of the patient. Now, here's some examples of what I mean. So this slide, sorry, I forgot this slide. This slide actually was taken from vetsland.com, and it gives the ranges of fructosamine for a normal cat and cats in various stages of regulation. I would, encourage you to follow the normal ranges or whatever guidelines your laboratory provides you with. But I just want to point out here that you'll see that in newly diagnosed cats can have normal serum fructosamines, which may be a reflection of how long that cat has had diabetes before the owner brings them in. Now let's take a look at some different cats that you might be presented with and how we should interpret their serum fructosamine. So Klaus here is a 17-year-old male neutered cat, prototypical, little orange fatty cat. He has been on insulin for 6 months. Owner says he has no PUPD. His body weight is stable, yet obese. And you do a curve and his sugars are between 90 to 450. And his serum fructosamine is 510. So then we have Arnie, a 13-year-old male neutered domestic longhair, who's only been on insulin for about a month. The owner says the PUPD is better, but it's still there. He's lost about a half a pound. And his curve ranges, 280 to 425. So kind of approaching, yet not quite into what we would consider a target range. And his fructosamine is also 510. So then you have Gia, who presents with the classic PUPD with the plantigrade stance. And she's a newly diagnosed diabetic who had lost about a pound since you had seen her 3 months previously. You don't do a curve because she was just diagnosed, but her serum fructosamine is also 510. So for Klaus, looking at those parameters, we would likely recommend no change of dose or even considering lowering the dose, since the nadir is sort of either toward the bottom of or a little lower than the nadir, your target nadir, depending on where you'd like to have it. And the range of glucose measurements in his curve could suggest that Samoji is present. So again, we would either maintain or lower his dose. And for Arnie, we would probably recommend increasing his dose a little, as he's early in regulation and his curve suggests and his clinical signs suggest inadequate dosing. Most importantly, that he's lost a little bit of weight. And Gia, obviously, we're going to start her on insulin since we just diagnosed her. So there you have it, 3 totally different clinical scenarios, totally same fructosamines. So again, interpret based on the patient you have in front of you. So on to glucose curves. So a glucose curve is basically just the serial glucose measurements throughout the dosage period. So, for a patient who is receiving insulin twice a day, this typically would represent 12 hours, and once a day, ideally 24 hours, although with a blood glucose curve, that can be tricky. These are often performed either at home or in the hospital with blood glucose measurements every 1 to 2 hours, and we'll go into that in the next slide. But recently, historically, blood glucose curves were considered the gold standard, but more recently, we've started using flash glucose monitors, which measure interstitial glucose for up to 14 days, which we'll go over later. The advantages of glucose curves is it provides an objective assessment of glucose throughout the entire day or dosage period. And it does allow for assessment of insulin onset and duration, and as well as glucose range and nadir. But some of the disadvantages can be affected by stress, and that there is known day-to-day variability, like I said, even in well-controlled animals, which if we're not careful, can lead to the wrong treatment decision. They cost a lot. The test strips are expensive, and they also can be inconvenient for the owner, both financially and time-wise. Next slide. So when performing a glucose curve in the hospital, the first thing I would do is have the owner feed and give insulin at home. I usually recommend this, even though we miss our pre-treatment value, because I think it's really important to try to maintain a quote-unquote normal beginning of the day, because this will provide us a better reflection of what happens on a typical day. Also, if we delay feeding the dog or delay insulin administration, this can impact the glucose curve immensely, and we won't really get a good, realistic picture. So once the pet arrives in the clinic, we're going to scurry them into the back and check a blood glucose as soon as possible. And we're going to get the owner's logbook from them. And we will keep the pet with us, monitoring the blood sugar every 2 hours. And we're going to encourage our staff to record the exact time the sample was obtained all the time. But then if the glucose drops by more than 200 milligrams per deciliter per hour, or our measurements are, it says 150 here, but maybe under 200 for a cat, depending on how comfortable you are. I would consider monitoring every 1 hour after that until you start seeing, you either see a hypoglycemia or you see the blood sugars coming back up to baseline. Because you'd be amazed at how quickly you can miss a hypoglycemic event during a glucose curve. So this slide here represents some of the parameters that we're going to want to evaluate in our curves. So obviously the onset of action is when the insulin first starts working. The glucose nadir represents the lowest point in the curve, and the duration of action of insulin is the time from which we first see action to when it reaches back up to our baseline. And, I typically like to have my nadir around 150-ish, although other endocrinologists recommend as low as 80. I'm always worried that when I see a nadir around 100 in my patients when they're in the clinic, that if they were at home running around having fun with their owners, they could have some asymptomatic hypoglycemia that we're not seeing. And typically, my target for these curves is 150 to 250 for a reasonable portion of the day. For cats, maybe 300, 150 to 300 would be a more reasonable range. But the important thing to emphasize is that rarely would we ever see the blood sugar in the target range for the entire day. And honestly, usually when I see that, I'm often concerned that the pet is potentially overregulated. All right, so now let's delve into some new technology. The Freestyle Libre is what's known as a flash glucose meter, which means that it reads interstitial sugar, but in order to see the measurement, you have to flash a receiver over the sensor. And the system consists of 3 parts. There's a sensor, which you see that tiny little wire sticking out in the picture to the right. And this sensor is inserted into the patient's interstitial space. And it connects to the transmitter, which is the white part that looks kind of like it's about the size of a quarter. And the transmitter will store the interstitial readings, which occur, I believe, every 1 to 5 minutes. And these readings are stored in the transmitter for 8 hours. Now, the people will either wave a receiver, which is that black device that is pictured on the slide, or they can also use an app on their phone, and they need to wave it over the transmitter every 8 hours, and the readings will go from the transmitter to the receiver or app, and then kind of empty out and then start making readings again. And as long as they wave this device over their pet every 8 hours, we'll get a full 24-hour curve, which is pretty awesome. Typically, these can stay on the pet for up from 1 minute, depending on how quick the cat or dog can be to swipe it off, to up to 14 days, which is amazing because, like I said, it'll give you 24 hours of interstitial readings throughout the day for 14 days. And for our purposes, I see this being most useful in the beginning of regulation, rather than it's not something I would consider using all the time, although there are owners out there who like that. And it's always a good idea when you're putting these on to set the owners up for the possibility that the pet can remove it by scratching or shaking, or some people will actually wrap these sensors to keep them on. So they shouldn't get upset if it comes off. It just happens sometimes. It happens to my son sometimes too, and he's a person. But it is really great also in that if the pet is wearing a Libre and the owner looks at them and they're concerned that they may be low, you can wave the receiver or app over the transmitter at any time, and you can see what the pet's interstitial sugar is at that time. It's important to note that these are validated for use in dogs and cats, but not technically labeled for them. But I do think that our veterinarians are starting to use them more and more. I want to show you a little bit more about how to interpret, or what we can use from this information. This slide, this graph was taken out of an article that just came out in the September Internal Medicine Journal, which I encourage you. It's an open access journal if you can access it. This is a great article summarizing the use of the Freestyle Libre in our patients, and it compares using the Libre to blood sugar monitoring. And the picture that we have on the screen is what is called the daily log report. And you see that the blue line represents the interstitial sugar throughout the day. The numbers that appear underneath that line represent any time that the receiver was waved over the transmitter, so it'll record those numbers too. And you can see in this patient, the red numbers are episodes of hypoglycemia, and the yellow numbers are hyperglycemia. This particular one is set up with the target range for people, so it's 70 to 180. I usually encourage people to try to change the target range to 150 to 250, just because it better signifies when our patients would be considered low versus a person. So in the article, they also have some recommendations of how to do dosage adjustments. They have, here it says if you'll have 50% of your glucose values are in your target, or your nadir is right around where you want it to be, you're not going to change the dose. If less than 50% are near your target, or your nadir is really high consistently, you're going to increase your dose. And if you have evidence of your nadir being low, you're going to want to decrease the dose. This says 50% of the glucose values, but to me, anything that would indicate actual hypoglycemia, that can just happen once, and I'm going to recommend lowering the dose. But as you can see, it's a wonderful tool that we can add to our arsenal. So now let's think about how we're going to use these different modalities while we are in our current challenging situation. So people certainly want to save money now. And from our perspective, we would like to limit the number of times they have to come to us for many reasons. And we also want to use our staff that are present efficiently. Let's see how the different modalities work, taking those things into consideration. So owner observation is free, and it's obviously done at home, so they don't need to come to see us, but we will have to spend some period on the phone, potentially talking to them about their observations. So obviously, I think that's necessary for all categories. For urine monitoring, there's definitely the cost of the ketodiastics, which I looked online, and they were about $27 at Walmart for 100 of those. It's done at home, so that's great. But it does require some time for us or our staff to interpret and give them advice. Serum fructosamine, there's obviously the laboratory fees, which I think it's not inexpensive, and the pet does need to be brought to us to get the sample obtained, so we'll need some hospital time, and our staff or us will have to spend some time afterwards, interpreting those results for the owners. Now for curves, obviously it's going to depend on whether you're doing the curve, the owner's doing the curve, but no matter who does it, the test strips are often the cost limiting factor for these because they are pretty expensive. And having the owner, do it at home obviously has the advantage of reducing some costs in that they're not going to be paying our fees, but it's can be still pretty pricey. And it's nice if they do it at home because they don't need to come in and see us. But no matter what, we are going to have to spend the time interpreting the results with the owner. And believe it or not, if we take into consideration the amount of information that we obtain and how long we could use the Freestyle Libre if the patient cooperates and keeps it on, if the Libre costs about $120, it's going to be different, obviously, depending on where you are. And there's actually coupons out there that people can use for them. The receiver is about $85 to $120. This can actually end up being cheaper in the long run than any of the glucose curve options that we have. And, typically most veterinarians do recommend that the pet be brought to us or to them to have the sensor applied, just to make sure that it all goes well. And often people will use tissue glue and different wrapping materials that people might have in their house. And this does require that the device that they're going to use to monitor the pet be left at the clinic, which is where the recommendation that the owner getting the receiver might make more sense, because if they are using the app, they're going to have to leave their phone with you, and nobody likes to be without their phone for a while. So again, the receiver is a good option for that. So clearly, I can tell you that because I've never applied one of these to a pet myself, but within my work, I am sent at least one or two different sheaths of reports that you can generate from the Libre. So it does definitely take some time to interpret the data, and obviously learning how to look at the different reports. But again, it's a wonderful, wonderful new tool for us to have in our arsenal. So in summary, Each of these modalities have advantages and disadvantages, whether they're cost, convenience, or accuracy. No one methodology is going to fit every situation. So when choosing among your diagnostic options that we've discussed, it's important to consider the situation at hand. And don't be afraid to try something new. Try the newer technology. But it's equally important to remember that sometimes the old ways work well too. If it's all we have, if urine sugar monitoring is all the owner can afford to do, or all they can emotionally afford to do, it is certainly better to do that. And you can definitely manage diabetes without super high-tech things. But luckily now we can also monitor it with high-tech things. So the most important message, which I believe I might have mentioned a few times, is no matter what methodology you choose, interpret the results based on the patient that is in front of you, and also take into consideration the owner's time as well. Well, thank you so much for giving me your attention for this time, and I will be happy to answer any questions that might have popped up during this discussion.
That was fantastic. Thank you so much. Great information.
Thank you.
Ton of people on here. So everyone, thank you so much for joining us. Really honored to have this CE sponsored by Merck. There have been a ton of questions so far. Last logistic before we start answering questions. In the chat function, I did provide the tiny link. So please make sure to fill that out right now. You have 30 minutes before we close it out, just to make sure people are watching it live to get their CE credit. And again, we will email you your CE certificate in 7 days, if not sooner. So please just make sure to check that out. No need to send a screenshot or anything like that anymore to Anne-Marie. Anne-Marie's overwhelmed with 400 emails. So hopefully this will make it easier. All right. So thank you so much for that information. I don't know how many people, it sounds like a lot of people are actually using the Freestyle Libre. And I did provide a link to another YouTube video from Dr. Audrey Cook and Patty Latham about how to put them on. You can use them in veterinary medicine, and they do stay on cats. So you can use them with surgical glue or use a vest. A couple of questions in terms of diet. What if you have a new owner, you're trying to adjust to, giving insulin, to managing the diabetes overall, to rechecks? How important do you think it is in order to wean them and start them on a diet? Does it make a huge difference? Dogs versus cats? Like, how much should we be investing in the nutrition?
Well, I think, for both species, diet is important, but slightly different depending on whether you're talking about a dog or a cat. For cats, because it's a little easier, we know that diet change, meaning the actual content of what they're eating, is imperative. There are tons and tons of diets out there that are acceptable for a cat with diabetes, typically canned foods. But if they are those cats who won't eat canned food, there are prescription diets that are available that are formulated for cats with diabetes. But I think anytime our goal is to induce remission, and I think for cats it's imperative that we convince the owner to change the diet. I remember speaking with a client about a cat who had been on Vetolin for a while, and they were complaining that it was never working. And I finally convinced them to put the cat on canned food. And like a week later, they called me, and the cat was unfortunately hypoglycemic. But it was a good message that that diet change can really impact their insulin requirements, and it's our best bet at getting them into remission. As far as, and I guess the other important thing to note is that it's okay to leave a grazer. You certainly, if there's a cat who insists on grazing and their weight 22 pounds, the last thing we want to do is make it so that try to force them to be meal feeders and then, go into the vicious cycle of them not eating and ending up getting hepatic lipidosis. With dogs, I focus more on the quantity they're eating and the timing of what they're eating more than the particular diet they're eating per se. Don't get me wrong. I think if I could have every dog on prescription diet it's formulated for diabetic dogs, I would. But given all the other areas where there can be expenses, I think we can leave them on their diet that they are taking, as long as it is a good diet formulating for dogs, and then just give the owner a measuring cup and say, you need to feed your dog this much, and make sure you try to give the insulin as soon as they're done, as close to as they're done, or whatever time it is, the same time every single day. So it's very different depending on which species you're talking about.
Great information. Thank you. Now, I see one question about what type of insulin do you recommend? Are there any studies proving it's glargine versus Vetsolin or things like that?
I think I often say that the best insulin to use is the one you're most comfortable with, the one you have the most experience with, because that's probably the best one, the one that you know how to use. I think the AHA guidelines speak more directly to, because if you ran into 10 different endocrinologists in the street, they probably would give you 10 different answers. I think Vetsolin is pretty consistently the first choice for dogs. I think glargine has a lot more press, a lot more articles written about it, but I've sort of taken the approach of with cats, we know the most common insulins that we use all can induce remission as long as they are used with aggressive monitoring and dietary therapy. So I would consider trying, one bottle of Vetsolin because it's the least expensive, and then sort of, giving them that one bottle to see if it's going to work. Because then you're either going to have a cat who's well regulated, a cat who's in remission, or a cat who's poorly controlled. And two of those three options are pretty good, and then you wouldn't have spent a lot of money, and then you could kind of go up the price escalator. But again, I think the insulin that you feel most comfortable with is probably the one I would start with.
Okay. I also did want to have you debunk a myth. There are certain types of insulins that have to be shaken. Yes. And most of the time we're taught to roll and not shake. So
I will tell you that I spend a great deal of time talking about this, not surprisingly, since Vetsolin is the one that has confused people so much. And I will tell you that the label on Vetsolin does recommend shaking it. I too was taught in veterinary school never to shake insulin because you're going to denature the protein and it's not going to work. So when I first started with Merck, I was like, what do you mean? What do you mean you're supposed to shake it? So it happens that Vetsolin had been voluntarily withdrawn from the market in 2009, and for reasons which nobody knows, they decided to study its mixing by shaking it rather than rolling it. So in that study, they confirmed that if you shake Vetsolin, it works just fine. So all I can say is Vetsolin needs to be shaken, and for all the other ones, usually rolling is what's recommended for those. And we don't have any information about, Vetsolin rolling. So I usually just, there's so few things we can control in the management of diabetes. Let's just do what the label says and shake it all the time.
Sure. I just wanted to bring up a point. I see a couple of questions. We'll do two more questions. One on, I wanted to talk about pens, and the second thing on fructosamine. The first one, when it comes to pens, is a lot of pet owners, especially with the new diabetic, are really nervous about giving insulin, and they're scared to give the injection. They're freaked out by it. And all of us feel so comfortable doing that. But I'm going to really encourage you, if you have not heard a good diabetic spiel for a pet owner, it is really important to nail down, because I've seen some interns who do a great job, spend $2,000 saving a DKA. The next morning when I talk to the pet owner, they're like, I can't give 2 insulin doses a day, and euthanize. So it's really important to reiterate the importance of commitment and feeling comfortable with the insulin. And if an owner's freaked out, please take the time to shave the back of the neck area so they can see where they're injecting into. That first time shave makes it so much easier for the pet owner. I always encourage them appropriate client communication, have them practice in the room in front of you. More importantly, have them use their smartphone and say, hey, why don't you videotape this while I show you how to give an injection, and get the cap off and, shake or stir or whatever, or roll. And that way you can watch the video as many times as you want to, right? So appropriate client communication is so important. If you have an owner who's freaked out about insulin syringes, I actually love the pens. And if you haven't had the opportunity to use the pens, I'm going to really encourage you to check those out, especially the VetSalon pens. A lot of pet owners feel much better stabbing their pet with a pen versus an actual needle. Obviously, there's a needle on there, but just physically, when they see that it's a pen, it's a bit easier. In full disclosure, I had to use, a pen type for hormone injections for infertility, and it was made by the same company. And the pens are actually really easy to dial and use. So definitely check that out. Okay, couple of questions on fructosamine. Garrett and I never measured our fructosamine because we manage DKA. So we're always like, follow up with someone else for fructosamine. Yay or nay? How often should you be doing it? Should we be using these Freestyle Libras more? I see a lot of people, I'm almost going to say overusing fructosamine, but like how much as an internist do you recommend measuring it in I'm trying to transition this person to the stable or this animal to the stable diet.
The thing about fructosamine and I actually have brought this up with my son's endocrinologist when we do an A1C, I cannot remember the last time I measured a fructosamine and I was like, oh my God, I can't believe that's what this pet's fructosamine is. Because it's usually, a pet who's, they're doing well, you kind of know that their fructosamine is kind of going to be okay. So, when in practice, I did not use them very much. And I think the biggest mistake that we make is, kind of I touched on it a little during the presentation, is, you have this beautiful cat whose hair coat is shiny where it used to be flaky and disgusting. Their body weight is stable. The owner is happy and everything's great. And the fructosamine is 450 or whatever poor control is for your lab. And you change the dose, even though the owner came at you with absolutely no complaints. So, I guess I don't love to use them myself. But if it's the only thing the owner will let you use, you can do it. But it's certainly, if you have a patient who you think is in remission, absolutely a great tool. Absolutely. Because, their fructosamines are either going to be normal or low. And to be honest with you, every time anybody mentions to me that their diabetic patient's fructosamine is normal, I'm like, you need to lower the dose. Because, if the glucose is that normal throughout weeks, that usually means to me that they're overregulated. So I hope that cleared it up a little.
Histamine or clot C6. Yeah. I'm like, you need to talk to an internist.
Yes, that's like me with scratching. Same thing. Somebody else.
Well, Dr. Reine-Salz, again, thank you so much for being here with us today. Amazing webinar, very, very helpful. As both Justine and myself said earlier, we definitely wanted to thank Merck Animal Health with their generous support as a great educational partner. We were able to provide this webinar free to the veterinary community, the veterinary world, and we do have people from all over the world joining with us today. Very quick reminder, we had this up earlier, I'll show it again, on the QR code on your screen and or the website address now that I just populated or Justine has populated in the feed. Please make sure to fill that out. That is the race requirement of how you are eligible to get CE credit for attending this live event. It's imperative that you do that. That's the only way to get CE credit. We will leave that form open for another 20-25 minutes. I plan on closing at around 2:15 p.m. Eastern. It's about 1:50 p.m. Eastern. Please, if you can, we'd love to hear your impression of this webinar. Give a great shout out to our speaker and or Merck Animal Health in that feed. We'd love to hear from you. And if you have suggestions of future events that you would like us to have, whether it's a YouTube live event, a webinar, a podcast, a video, let us know. Please type that into the screener as well, the question feed on YouTube, and Justine and I will review any and all of that. Again, Dr. Reine-Salz, thank you for being here with us today. We appreciate that. For those of you that have joined during your busy clinic day, thank you. We know it's a stressful event. The caseload has never been higher. Stress level never higher. Emotions never higher. And keep doing what you're doing. You are well respected, loved, and appreciated. And we thank you for being there and here each and every day. So again, thank you everyone for being here with us today. Can't thank you enough for doing what you do. We hope to see you online at our next VETgirl event or our VETgirl U conference, which we're excited to have in August. So if you have questions about that, check out our website, email us. We don't care. We're happy to talk to you. With that said, though, I hope you have a great rest of your day. If you're on the East Coast, stay safe in the snow, sleet, and rain. Justine's used to this out in Minnesota. They see 5 inches and they wait for another 5 more before they plow. That's their Monday morning. But everyone,
and don't forget, if you have colleagues who missed it, they can't watch it live, they're not going to get CE, but you can always watch it again. So great information. Definitely check that out. So we'll see you at the next one. Thank you guys so much. And again, a huge shout out to Merck and